Testosterone therapy and the risk of atrial fibrillation, venous thromboembolism, and cardiovascular events in cis men with hypogonadism and trans men by Bonnet et al. Cardiovascular safety of testosterone therapy in cis men remains uncertain. The data is limited for trans men receiving testosterone. Both groups may have distinct risk profiles and treatment contexts. The aim of the study was to compare cardiovascular events, mortality, and suicide attempts in cis men with hypogonadism on testosterone and trans men receiving testosterone therapy. The study analyzed data from 150 million adult patient records in a retrospective observational design. 3 cohorts were identified and the following groups were compared. For treated patients, the index date was their first testosterone prescription. For untreated controls, it was their first relevant consultation. Baseline characteristics were assessed over the 3 years prior, and in trans men, testosterone levels were measured before treatment and again 12 to 24 months after starting therapy. For cis men on T, there was no difference in mortality, suicide, and stroke risk. There was a lower risk of acute MI but a higher risk of AF, acute pulmonary edema, or DVT. For trans men on T, there was no difference in mortality or cardiovascular events, but suicide risk was lower compared to trans men without T. In trans men on T, there was reduced mortality and AF risk, but a higher suicide risk compared to cis men without T. In trans men on T, there was a high risk of MI and suicide, no difference in stroke, AF, or mortality, and a lower risk of PE and DVT compared to cis women without T. Conclusion: in cis men, testosterone was linked to increased risk of AF, PE, and DVT, reduced risk of myocardial ischemia, but no mortality change. In trans men, there was no rise in cardiovascular risk and reduced suicide attempts. Testosterone appears safe in trans men but requires monitoring in cis men. Scan here to read the full article.